You are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of the Ladies' Room. Now, one of the most common questions we get from our listeners and through my website at drdonica.com is from women who are literally pulling their hair out because of being worried about hair loss. Now, as someone with gynecology and women's health training, I am very well versed in addressing the very normal hair loss associated with what we call hormonally sensitive transitions, especially as a result of birth control pills, the postpartum period, or menopause. And whenever I hear women complaining about unexplained hair loss, my first thought is to talk about their hairstyling or coloring habits, but then to make sure that they have their thyroid hormone levels checked, as both underactive and overactive thyroid problems may cause or contribute to hair loss. But beyond those recommendations, I have to refer to a dermatologist. So today I thought it was time that we welcomed a real hair loss expert into the ladies' room. Today we have with us Dr. Angela Phipps, who's the new Hair Club company's spokeswoman and medical advisor. Hair Club is the largest provider of all proven hair loss solutions in North America and was called Hair Club for Men for its first few decades. But now it's just Hair Club because they're embracing the fact that women have hair loss issues also. So they have over 120 centers in North America, but what I'm really excited about is that they now have a new state-of-the-art salon in Atlanta, Georgia that caters exclusively to women. Now, let me tell you a little bit about Dr. Phipps. She has an alphabet soup list of letters after her name, including BSN, DO, ABHRS, and we'll talk about what all those things are. She's a board-certified physician with Hair Club's affiliate, Bosley Medical Group. She's based in Raleigh, North Carolina, where she specializes in surgical hair restoration. But she took a long, circuitous medical training path to get there. She first got her Bachelor of Science in Nursing degree from Marshall University in Huntington, West Virginia, then got a Doctor of Osteopathic Medicine, DO degree from the West Virginia School of Osteopathic Medicine. After that, she completed her surgical training at Botsford General Hospital in Farmington Hills, Michigan, in otolaryngology, or what we commonly call ENT, which is ear, nose, and throat surgery, and facial plastic surgery. And because she clearly didn't have enough residency training by then, she then went on and finished a residency in family medicine at Suncoast Hospital in Largo, Florida. And then finally, she completed a specialized fellowship in surgical hair restoration at Zering Medical in Beverly Hills, California. So I think we're going to ask her what's next. But she's board certified. What is it? Pediatrics? Dr. Phipps is board certified in medical surgical hair restoration by the American Board of Hair Restoration Surgery. And I have to admit that until today, I didn't even know we had such an entity.
Who knew you could be board certified in hair?
I did not know that, but it's very appealing, and we are going to talk about that. Now, while we're very accustomed to talking about hair loss in men, or the typical male pattern baldness, studies show that nearly 40% of women will experience some type of hair loss before the age of 40. The most common cause of hair loss in women is called androgenetic alopecia, which is a genetic predisposition to hair loss. However, women can lose their hair for a whole host and a whole number of other reasons, and we are going to try to get to all of them. Welcome to the ladies' room. Well, yes, how did you find out that you could get board certified in hair?
Well, I took a long route to get to where I am, but usually in any subspecialty field of medicine, they do offer, board certification so that you can show your patients and other colleagues that you have taken the necessary steps in additional education to be an expert in that field. And so hair restoration, medical or surgical, is a small subset of surgery that usually dermatologists go into, ear, nose, and throat, or even, some family physicians go on to specialize in it. And in order to be what they call board certified, so that patients can feel confident in going to someone who knows they've had additional training, that will be the best to suit their treatment.
Now, one of my classmates in medical school said that when she was trying to decide whether to go to medical school, she was trying to decide whether to go to medical school or cosmetology school because she felt both things made people feel better. But I'm going to guess you didn't start out on this long medical training process saying, I'm going to go into hair restoration.
No one goes to medical school saying, I want to be a hair doctor.
Right. So how did that come about? How did that evolve? And why did you go through so many different residencies before figuring that out?
Yeah. So it's funny. As a child, I did want to be a hairdresser growing up. And my mother said, you're too intelligent and have too much going on to stand on your feet all day and not make very much money. Mm-hmm. So I think really in hindsight, I think, if I sat down with a psychiatrist, they would say I became a hair doctor just to spite my mother, But I was always a tomboy growing up. So I was my daddy's little boy that he never had. And I was always the kid who liked to look at roadkill on the side of the road, So, but I also really liked to help people. Mm-hmm. And so there was a lady at my church who was a nurse anesthetist. So she had her bachelor's degree in nursing and then a master's degree in anesthesia. And they made really good money. And so I knew I liked to help people. And of course I wanted to make good money. Mm-hmm. So I set down the path of, going to be a nurse with the intent of being a nurse anesthetist. Mm-hmm. So during nursing school, I also played college softball.
Oh, good for you.
Coached a little league girls team as well. And two of the dads on the team were nurse anesthetists. Mm-hmm. So they allowed me to come in with them on the weekends and see what they did and that sort of thing. So after a while of doing that with them, I decided that's not what I want to do with the rest of my life. And so really I'd only went down the path of nursing to get to anesthesia. So I didn't want to do anesthesia. So I'm like, what am I going to do now? Mm-hmm. So I was working as an extern during my nursing training and was working in surgical intensive care. And I really liked the surgical aspect of it. And to be quite frank with you, I got tired of doctors telling nurses what to do whenever I felt like I was smart enough to be the doctor telling other people what to do. So after I completed my bachelor's degree, I decided to go back and get my prerequisites to be able to take the entrance exam to medical school, and took it, got in, and headed down the path of, going to become a doctor. And I knew I liked blood and guts and like that sort of thing. So I knew some sort of surgical field was in my future. And so trying to combat, but I also really liked dermatology as well. And so I couldn't really decide between ENT or dermatology because I didn't really want the life being a woman of a general surgeon, or what I would probably ended up being would be a trauma surgeon, knowing that I wanted to be married and have a family. And so I'd settled on ear, nose, and throat, facial plastic surgery. And then, you get into that and I think, that's not what I want to do with the rest of my life. I probably should have went through dermatology. And so I was really thinking about switching into dermatology, but
I think at this point, the psychiatrist would be kind of evaluating you for ADD.
Yes. So in the interim of pursuing going into a dermatology residency, I had missed the cutoff for acceptance. So you have to wait a year.
Oh.
And so I finished a family practice residency in the intent of going on and doing dermatology. Mm-hmm. However, as luck would have it, during my family medicine residency, I met a doctor in Florida who did hair transplants. Mm-hmm. And my dad was bald and wore a toupee for 30 years.
Oh my.
I said, you need to teach me how to do this because my daddy is bald and he wants hair. So during my family medicine residency, I was actually able to assist that doctor in my dad's first hair transplant.
Oh, wow.
That he had. And then after I graduated that residency, I gave my dad his second hair transplant under the supervision of this other physician. And after the results that he got from 2 transplants, my dad looked at me and said, I like my reflection in the mirror once again.
Oh, I wish we had a picture.
It totally changed his life and the way he felt about himself. So I go home and I tell my husband, pack your bags, we're moving. He's like, what do you mean we're moving? I said, we're moving to Beverly Hills. And in the interim, I had been in contact with the International Society of Hair Restoration Surgeons and went to their annual meeting and met some other physicians who actually offered fellowships just in medical and surgical hair restoration. And so one of the doctors was in Beverly Hills, which was Craig Ziering, and I did applied to his fellowship position, got accepted, and went on out to Beverly Hills to complete that additional training.
And how long of a training program is that?
It was 1 year.
Okay.
And then after that, you actually have to practice a couple of years before you can set for the ABHRS, or the American Board of Hair Restoration Surgeons, to become board certified, because you have to have enough case logs in order to turn in to the board to show before and after pictures with surgical operative logs and things like that to be able to pass that part of the requirements, as well as sitting for an oral exam and a written exam. And so it took 2 years after that for me to compile all of that and get that together. And then I took the exam and got my certification.
Now, what percentage during your fellowship, about what percentage of your patients would you say were men, and about what percent were female?
It's about it was about 90% men and 10% women. That is growing over the years. I mean, I've been doing this for almost 15 years. And so with the increased media coverage and physicians talking about female pattern hair loss, and with facilities like Hair Club, who specialize in women's hair loss, it has become much more a higher percentage of patients that we're actually seeing and treating.
Great. Now, obviously, I know very little about this hair club process. For me, a hair club is going to my salon and having my hairdresser do what she does. And in fact, I just heard a story on the news today about a murder or a missing persons investigation that was launched in Tennessee because a woman missed her regular hair appointment. And it was her hairdresser who called the police. Her own husband had not reported this woman missing. So of course that was an immediate red flag, but this hairdresser just kept insisting this woman would never, ever, ever miss this appointment. You know, she has a standing hair appointment with me and she would certainly never miss without canceling. And so of course, every woman listening knows that we have a very close, intimate relationship with our hairdressers, who many times are doubling as our psychiatrists or our psychologists. I've had my own hairdresser for 25 years. And my own daughter said to me a couple of weeks ago, Mom, the 80s called, they want their hair back. But anyway, so
I like my.
Well, you have amazing hair.
I got humongous hair now. When I'm at work, I don't wear it, down like this, because it can be very intimidating to a woman suffering from hair loss, and they come in, their doctor's got all this hair.
Well, that's one of my big objections to all the doctor shows like Grey's Anatomy, which I love the show, but the number one thing that drives me crazy is how all these women are supposed to be surgeons and their hair's in their face.
Yeah.
I'm like, no, that would never, ever, ever, ever happen. That you'd be thrown out of the OR. But so what is the process? Obviously, a person doesn't just walk into hair club, especially a woman, and say I have hair loss, and then they immediately get, some kind of restoration process. So what's the medical workup that's required or recommended before somebody goes into this process?
So hair club facilities don't actually have a physician on site. They're a company, we have a working relationship with the company that I work for, which is called Bosley.
Got it.
Bosley physicians do the surgical hair transplant part, as well as some medical hair restoration modalities that have to be prescribed by a doctor. Mm-hmm. Other medical hair loss modalities can be received through the advisors at Hair Club. What will typically happen is a female will go into Hair Club and have a concern about hair loss. And if it's not apparent to the clinician who is there, as far as not a physician, but whoever's working there.
And so what type of clinician would that be? What kind of training do they have?
Yeah, I guess I shouldn't have called them clinician, right, because it's just the
technician or are they more of a receptionist?
The technician, because the technicians who are there, because Hair Club offers hair loss solutions to women with a product called X-Trans Plus. Mm-hmm. And that's actually taking hair and putting it into a weaved system that is actually used as a medical grade adhesive to apply to the scalp. Mm-hmm. So it's like a semi-permanent wig. Mm-hmm. And so they're used to seeing women with hair loss and just overtraining. But if they're uncertain of what could be the potential cause of the hair loss, then they refer them over to me, to the Bosley office. And then I sit down with them as a physician and give them a long history and physical and an evaluation and an examination of the scalp to see if we can find out what the cause is.
Well, Hair Club is all over North America, so you can't be seeing all of these patients. So are there physicians in each city that there are hair clubs who they refer
Yeah,
to?
so there's a Bosley office usually wherever there's a hair club office.
Got it.
And so they refer you over to the Bosley office. Luckily, our two offices are just 2 miles down the road.
Okay.
Sometimes they can be in different cities, and they don't have to come, to a Bosley physician for diagnosis if the Bosley office is too far away from the hair club office and the hair club really thinks that they need to see a physician. They'll tell them to go to probably see a dermatologist.
Well, shouldn't somebody always see a physician first before going through this kind of process?
Yes, and sometimes women who have walked in who go into hair club have already been to see the dermatologist or their general practitioner and ruled out all the other causes and exhausted all of their treatment options. And
So do they have to sign off on something and say, I have received medical evaluation, or is that a requirement?
It's not a requirement, but the clinician or the technician there will ask, have you seen a doctor? What tests have been done? And try and get a little bit of a history to make sure that they're not missing something.
Okay, so this is a great lead-in to my number one topic that I want to discuss with you is I want to go through what are all of the, say top 10 most common causes of hair loss in women. And so let's start with the one that affects probably the most young women is being on birth control pills or other medications. So you want to address that? Yeah.
So the first main cause is what we call androgenetic, hereditary female pattern hair loss. So andro, means hormone, genetic means you inherited it. And it's an old wives' tale that if your mother's father's bald, you'll be bald too. It can come from the mom's side. It can come from the dad's side. But those individuals have inherited hair follicles that have receptors inside those follicles that are just overly sensitive to hormones in your body. And they can be overly sensitive to if the hormone levels are too high, if they're too low. But what is so frustrating with female pattern hair loss is your hormone levels can be absolutely normal, but your hair follicle receptors are just overly sensitive to certain things.
And which hormones are we talking about?
Estrogen, progesterone, dihydrotestosterone, testosterone, prolactin, thyroid, cortisol.
Okay,
there's a whole list. Yeah, and female pattern hair loss is so difficult because there is a whole list of hormones that can cause the imbalance that can result in hair loss. In men, there's one hormone, which is dihydrotestosterone, that's the culprit of their hair loss. Women, we are a much more complicated species, and many different hormones cause loss in women. And it's frustrating because what one hormone will cause hair loss in one woman, it's not the same hormone that causes the hair loss in another woman. And there's no genetic test that you can do that can tell a woman, this is the hormone that's causing your hair loss, and here's a pill or a treatment that we can give it to stop it. Whereas in men, because their hair loss is caused by one DHT hormone, there is a medication called finasteride, brand name's called Alopecia, that we can actually give them to halt the production of that hormone and stabilize and stop their hair loss. And there is no magic pill for women.
Of course not.
No, of course
there
not.
never is. But so
the birth control pills, you got to be careful, as you know, that different percentages of the estrogen or progesterone that you're using in the birth control pill can be a trigger for your hair follicles to indicate a hormonal shift and can cause the hair to, start to shed. And so the ones that tend to do that are the androgen, ones that have more of an androgen base to it. And so, I have a list of hormone, contraceptions that are more likely to cause hair loss and least likely to cause hair loss. But even the ones that are least likely to cause hair loss can cause it in one person, and the ones that are most likely to cause it won't cause it in another person. So sometimes it can just be trial and error.
Right. And it might not be the pill.
And it might not be the pill at all.
So what other medications can commonly contribute to hair loss in women?
Yeah, so high blood pressure medications are commonly known as specifically what we call the group of medications called beta blockers. Antidepressants can cause hair loss in women, notably Paxil, Zoloft, and lots of women in their menopausal years are on hormone replacement therapy as well as antidepressants, and you put those two together
and blood pressure medication
and the blood pressure medication. Exactly. As we age, we're on a lot of these different things that put together in the right person can just have a very dramatic effect on their hair.
Right. And aging itself can contribute to hair loss in women.
Yes.
Now, when we're talking about, typical patterns of hair loss in women versus men, where are we talking about the hair loss primarily occurring, or what pattern do you see? We're all familiar with the male pattern baldness.
Yeah. The male pattern baldness is the receding of the temples with a bridge of hair across the top and a bald spot in the back, or the whole top of the head can be gone.
I call that Julius Caesar hair.
Yes. Women's hair loss isn't patterned like that. We call it female pattern hair loss, but what we typically see in women is just an overall diffuse thinning of the hair where you start to see through to the scalp when the light shines, when the sun shines. And so it's really just diffuse loss without any major bald spot. Women tend to retain the frontal hairline zone with thinning behind it.
Got it.
Now, I do have some women in my practice who have the typical male pattern hair loss that I have transplanted. But as a general rule, female pattern hair loss is typically classified or is seen as diffuse overall thinning, or what we call a Ludwig pattern, where you have the center part just starting to widen like a Christmas tree,
Right.
Sort of thing. So widening of the center part or diffuse overall loss is the hallmark of female pattern hair loss.
Now, in women who have male pattern baldness, do you recommend testosterone screening or DHT screening in those women?
They will
Or is it
probably have
unrelated?
already seen an endocrinologist or a dermatologist or a family practice physician. And if they haven't, I would recommend that they have their androgen levels for sure checked.
Okay, because there are many conditions like polycystic ovarian syndrome
PCOS,
where women have elevated testosterone levels.
testosterone levels.
But we also see that in menopause, where
Absolutely.
it's not necessarily that they have elevated testosterone levels, it's that their estrogen levels are so diminished that, relatively speaking, their testosterone comes
Level
higher.
is high. Yeah.
Or there are women who are getting treated with testosterone analogs for decreased libido.
Correct.
And, you know, that's a controversial subject in and of itself. We'll do that on another episode of In the Ladies Room, because it's an important subject.
Yes.
But that's another controversial subject. So, of course, most of our listeners are probably aware that chemotherapy classically causes hair loss, and that
it causes a different type of hair loss. One of the hair loss, or the type what we classify chemo, is we call it anagen effluvium.
oh my goodness.
Yeah, there's a real big name for that. So the hair growth cycle has 4 different phases. One's called the anagen phase, and that's the growth phase when the hair shaft is actually growing.
Mhm.
And that lasts for anywhere between 2 and 7 years. And then it'll transition into another phase called the catagen phase, which is the transition phase, where the outer root sheath of the hair follicle starts to pull away. And that takes about 2 weeks to do that. And then it goes into another phase called the telogen phase. And that's where the hair is no longer growing, and it forms actually what we call a club hair. And it's just kind of laying on the scalp or kind of detached. And when you comb your hair, there's hair in your brush, there's hair on your pillow, there's hair in your sink. And that's that club hair. And if you look at it sometimes, or if you pull your hair, it'll have that little dry white area at the bottom of it. And people think they're pulling out their hair follicle when they are not. That's just the remnant of the club hair. Mm-hmm. And that lasts about 4 to 6 months. And then it goes into the exogen phase. You know, who knew there was all these phases to hair, where the new hair pushes the old hair out. So the anagen phase is the growth phase. So anagen effluvium means to shed. Mm-hmm. So anagen effluvium is when something affects the mitotic ability of the hair follicle cells. So when you receive chemotherapy, it shuts down the mitotic activity of the cancer cells, but it also
shuts the growth activity.
The growth activity, right. So it shuts down also the growth activity of the hair follicle cells, and the hairs fall out while they're in that growth phase. Mm-hmm. And so it has a term called anagen effluvium. So there's the term also called telogen effluvium. And so there's no cytotoxic metabolic cause to the hair falling out. This is what we term the medically induced cause. So medications, stress, undergoing general anesthesia, medications, those all cause the hairs to stop being in the anagen phase, jump to the telogen phase, where they prematurely are in that resting phase where they shed out, because they should still be in the anagen phase for 2 to 7 years. But there's something that's insulting those hair follicle cells and causes the anagen phase to stop, shifts over into the telogen phase and they shed. Because it's normal to lose 100 to 150 hairs a day. If I would brush my hair right now, I would have lots of hairs coming out because it's normal to lose a certain amount every day. You have about 3% of your hairs that are in that telogen phase because new hairs are growing. But your hair follicles are very sensitive, finicky little organs that it will detect any chemical imbalance or change in your system and will shift over into that telogen phase and cause the shedding that people see.
Okay, so speaking of shedding and increased number of hairs in your hairbrush or at the bottom of the shower, talk about the hair loss that comes after pregnancy.
Yes, and so that's, with pregnancy and after pregnancy, your hormones are shifting like crazy. And so the shift into that telogen phase, because of the hormones, you'll see those hairs coming out and coming out and coming out. Now, that's a temporary thing. Once the hormones rebalance, that hair will start to grow back. However, it has to go through that resting phase, which is like 4 to 6 months. And so right after the birth, it's still going to continue to shed, and you won't see recovery of that thinning hair for about 6 months, even up to a year, because the hair has to go through that 4 to 6 month process. And so
I feel like during pregnancy, it seems like hair growth or hair thickness increases significantly. So I feel like it's not really a loss. It's kind of just losing what you gained
during that time.
Pregnancy. And is the gain during pregnancy mostly attributed to your soaring levels of hormones, or because of your prenatal vitamins, or a combination of both?
A combination of both.
All right, because of course nutritional deficiencies can also contribute to hair loss.
Yes, and so during pregnancy, women are eating better, right, which increases, the cellular capacity of the hair follicle cells to produce a stronger, hair, thicker hair, longer hair.
And what easy for me to say, what nutritional deficiencies most commonly contribute to hair loss? What are the first things you think of?
Yeah, the B vitamin deficiency, an A vitamin deficiency, a D vitamin deficiency. And you got to be careful with vitamin A, because excess vitamin A can cause hair loss, whereas too little vitamin A can cause hair loss. And so that also goes into a medication, vitamin A derivative medications like Accutane. Mm-hmm. So we'll see hair loss in the teenage population. They'll, mothers will bring their sons and daughters in, and they're 16 and 17, and just say their hair's been coming out over the last 6 months. What's going on? And in my health history, I always ask, are you on any sort of Accutane or vitamin A, derivative medication for it? Because what that does is it decreases the sebum production in the skin, where it also decreases that oil producing gland in the hair follicle and shuts down and changes the chemical alteration of the hair shaft, and will cause the hairs to shift into that telogen phase.
Well, and it's interesting that you mentioned vitamin D, because about 40% of women in the United States are vitamin D deficient.
Exactly.
So, I think that's a take-home message for everybody who's listening, whether they have hair loss or not, is that all women, in my opinion, over 21 should have their vitamin D levels checked, because it affects so many systems in our body, but it's also so easy to correct that. That's a real easy one to fix. So I think that's something we really need to hone in on. Now, of course, we would be remiss if we were talking about nutritional deficiencies and hair loss and didn't talk about anorexia and the effect of anorexia on hair loss.
Because anorexia makes your body go into a state of ketosis, mm-hmm. and that your hair follicles detect that internal metabolic change and shut down. It's not a good environment or a healthy environment for your hair follicle cells to be in that state of ketosis that your internal body is. I mean, your menses shut down during, anorexia. And your hair follicles, shut down as well during that state of ketosis. Everything's going into a starvation mode of protection, and your hair follicles do the same thing.
Well, and we see that in anorexia nervosa, but also in medical causes of anorexia and geriatric causes of anorexia.
Exactly.
And medically induced causes of anorexia. Now, what causes of hair loss did we not touch on yet? I feel like we're missing one category.
Let's see.
We got age, medications, nutrition, certainly pregnancy, hormones, chemotherapy. We touched on menopause and perimenopause when we're talking about hormones. Oh, infections.
Yeah, again, anything that alters the chemical balance of your body, and infection definitely sends inflammatory signals, and your hair follicles are very, very sensitive to any form of inflammation. And when they detect inflammation from an infection, they're going to shut down and go from that anagen growth phase into that telogen resting phase to protect itself. Now, it can take, 4 to 6 months for your hair to recover from any insult, because it has to go through that 4 to 6 month of that telogen resting phase before it'll go into the exogen phase and revert back to the growth phase. So people have to be very patient with hair loss when we can identify a cause that as soon as you remove the insult, it's not automatically going to correct itself. There's a 6 to 12 month waiting period of getting that to come back, because you have to wait through the telogen phase, which is 4 to 6 months. And hair only grows about 1/4 to 1/2 inch a month, to regain all of that volume that was lost because of the insult. And then chronic antibiotic use, as far as medications that you might be using to treat an infection or to treat it. People have diverticulitis, and they're chronically on antibiotics off and on to treat this medical condition. And, the antibiotics can affect the gut flora, takes away the absorption capacity of the gut. You become vitamin B, deficient. So the deficiency in the vitamins coming from the antibiotic use, or just from the changing the internal metabolic state. Your hair follicles recognize that, and they just shut down to protect themselves.
Now, of course, from a GYN perspective, anytime our patients are on antibiotics, we're putting them on probiotics to prevent yeast infections. Certainly, probiotics have gotten a lot of attention for helping with a lot of the complications of antibiotics. Do probiotics have any role in diminishing the effect of antibiotics on hair loss?
I haven't seen any studies that state that, but it just makes common sense that it would as well.
I'll do it anyway for the other reasons.
Yeah.
Okay, so when I said I was feeling like we forgot a major category of causes of hair loss that we didn't discuss, this is going to be a dumb moment. We haven't yet discussed the major insult to hair that we do to ourselves, which is hair coloring, chemical processing, treatments, blow drying. And I've heard that even, aggressive ponytails that are, and this I'm guilty of. If I'm not in a professional situation, I'm in a serious ponytail. So why don't you address all of those kind of hair styling issues that can be insults to our hair? Yeah.
So when we're talking about, there's actually a term called traction alopecia. Traction meaning chronic pulling of the hair. So when we pull our hair back in those tight ponytails, you can see that we're pulling the hair. So after years and years of that tight pulling on the hair, it can kill the hair follicle just from constant pressure, because that pressure produces inflammation. And so even though it's mild and you can't see anything clinically, subclinically or underneath the surface of the skin, that chronic pulling, that chronic traction produces a low-grade inflammation that over years and years of time can actually, affect the hair follicle to where it stops producing hair.
Well, and when I was younger, I used to use rubber bands for my ponytail instead of now the, sophisticated pony holders.
In African American culture, it's very, ethnic to cornrow or really tightly braid those hairs to the scalp, the wearing of weaves or wigs that put constant pressure. And so, at least once a week, I'm probably doing a hair transplant on an African American female for traction alopecia across the frontal band, where women will come in and say, I've lost my edges. And they've lost the edges. The hair follicles have lost the capacity to produce new hair because of years of the hairstyling or grooming practices. That's just a part of their culture. And so it's just a part of us being educating. And so, there's an old song that says, Mama, don't let your boys grow up to be cowboys. And when I have my African American female patients in here, I'm like, Mama, don't let your babies grow up to wear hair weaves, or tightly braid the hair, because after years of affecting the hair follicle, it will stop producing hair. Now, the over processing and over chemicalizing of, getting hair color and highlights and those sort of things, those don't typically permanently damage the hair. It damages the hair shaft. The overprocessing causes the hair to break, but it's not permanent. That hair will fall out, and then 4 to 6 months it'll start to regrow a new one. But then when you chronically put the chemical onto your scalp or chronically stress that hair after a lot of processing, it can eventually again affect the hair follicle to the point where it says no more, I'm done, and doesn't produce any more hair shafts.
And what about the effect of heat? So blow drying, hot irons, electric curlers, those kinds of things.
So those types of things typically affect how long the hair follicle will be in that growth phase. Mm-hmm. And so it will shorten the anagen phase of the hair follicle cycle. So yeah, overprocessing with heat, because if you put a hair blow dryer to your scalp, it can burn you. It's hot. And so that daily use of hot irons and hair blow dryers typically doesn't cause any permanent lasting hair loss. It just usually affects the breakage of the hair shaft itself. But I tell my women patients, you got to give your hair holidays. It's not good to wash, blow dry, and flat iron your hair every day, because you're just causing heat injury that over time your hair follicle will eventually say, I've had enough.
And you're wasting a tremendous amount of time out of your day. That's another advantage of the ponytail. I remember a few years ago, I went to do an interview at Glamour magazine, and they had a mock-up of the upcoming issue of the cover. And there was this huge announcement, the ponytail is back. And I was like, yes. Anyway, so speaking
people make fun of those scrunchies, but the scrunchie is the best thing that you can use on your hair, because it's a soft fabric that doesn't cause that real tightness that a rubber band type of a ponytail holder does.
Right. Another advantage of the 80s. We don't really use the scrunchies anymore, but now they have those more sophisticated, sleek ponytails.
Satin material band.
So another question from sort of my sordid history. You're talking to somebody who's a recovering competitive swimmer. So talk about the effects of long-term chlorine exposure on your hair.
Yeah, long-term chlorine exposure, again, that chemical, is on the scalp day in and day out, and can affect the ability of the hair follicle to stay in that growth phase and shorten the growth phase. And so a lot of competitive swimmers, sometimes they come in and they'll say, I can't get my hair to grow. Mm-hmm. It'll only grow to my shoulders and then it stops. Right? And so it's because that constant chemical insult causes the hair to shorten in that anagen phase, which should be 2 to 7 years. And if your hair grew for 7 years, it'd be, long like mine down your back. But when you shorten that anagen phase from the chemical exposure to, a year, then your hair is only growing 6 inches in a year. And so you can never get past that point of your shoulders because of the repetitive chemical insult and how it affects the cycle of the hair and how long it grows.
Now, we used to actually call that swimmer's hair. Mm-hmm. And in many swimmers, and I never had this fortunately, but my sister did have it, it actually can be extremely thin, but then also break. And my sister,
it's like the processing of the peroxide. The peroxide can cause the hair shaft to break. The chlorine can cause the hair shaft to break.
Well, and many blonde swimmers would actually get greenish hair.
Green hair, yep.
From the chlorine. But my sister had this problem where she had such thin hair, and now, 25 years later, she has hair that's about as thick as yours. Oh, but for, a long time when she was swimming, it was, really, really thin. And I always used to say, oh, I hope that doesn't happen to me. Now, do any of those products that are advertised for use after being in the water or after chlorinated water prevent that, or do they just change the effect of the color on the hair?
They're really just changing the effect of the color. They're affecting the pH and how the cuticle of the hair shaft absorbs that chlorine color. And so it's helping protect the cortex of the hair shaft.
Mm-hmm. So all right, well, now I think we've covered just about all the causes that we could think of. So let's switch gears a little bit and talk about, suppose a woman notices that over a couple of months period of time, she's having noticeable hair loss. I think we probably both agree that her first stop is to her primary care physician. Mm-hmm. To talk about that. And her primary care physician would probably be the person who would evaluate, all of the medical things and decide, do the screening test, decide if she needs a referral to an endocrinologist or a dermatologist. Because certainly when we talked about infections, we didn't specify these could be systemic infections or they could be infections of the scalp.
Yeah, especially fungal infections of the scalp.
And there are shampoos for that.
Correct.
And some primary care physicians feel very comfortable making those diagnoses and those prescriptions, but some will refer you to a dermatologist, for those kinds of things or any apparent skin things. So then the person goes to a dermatologist, and the dermatologist does their thing, or an endocrinologist, which would talk about hormones, et cetera. And at what point do they come to a Bosley physician or to a hair club?
Yeah, so they will do the hormone test, or the lab test, I should say, to make sure you don't have iron deficiency anemia, thyroid problems, check your prolactin levels and those sort of things. If all those things are normal, then sometimes the dermatologist might even do a scalp biopsy. It's where they look at the cells underneath the skin to make sure that you don't have what we call scarring alopecia.
Okay, now what is that?
So scarring alopecia are medical conditions where subclinically underneath the surface of the skin, there's chronic inflammation and your body is replacing normal epithelial cells with scar tissue. And that scar tissue is putting constant pressure on the cells of the roots of the hair follicle. And over time, that pressure kills the cells in the papilla or the root of the hair follicle to where it won't produce hair anymore. And if you have a scarring alopecia, you're not a transplant candidate, because if I took hair from the back of your head and put it on the top of your head, the same thing or process that made the first hair fall out will make the new transplanted hair fall out.
Now, if a patient has not had that biopsy, is that something that you recommend before a transplant procedure routinely?
I will often refer them out for biopsies only if I'm unsure. If they don't have what we call the classic female pattern hair loss, or there's any question of whether there could be what we call diffuse alopecia areata. So alopecia areata is an autoimmune type of a disorder where you usually lose hair in little circles, and but sometimes it can be diffuse. And so there's not little patches to be the triggering, definitive indicator. And so it can be diffuse and it can mimic male or female pattern hair loss. So if I'm looking and I do a scalp evaluation, and if I'm looking and there's any indication of there's something looking not quite classic female pattern hair loss, we'll refer to get a biopsy, because we don't want patients spending money on something that's not going to grow.
Now, can alopecia areata be treated?
It can, but it's from a hair transplant standpoint. But it's I want to say
talking about from a medical standpoint.
If caught early enough, dermatologists can inject steroids underneath the scope, because the cause of it is inflammation. So if you catch it early enough, sometimes you can inject steroids underneath the surface of the skin. And the purpose of steroids is to decrease inflammation. So
they can't just take systemic. Ooh, I just hit my microphone. They can't just take systemic steroids?
No, you don't take systemic, because you need to get that steroid at the level of where the inflammation is occurring in the dermis and the subcutaneous fat of the scalp, where the root of the hair follicle located, where that inflammation is occurring. Because you're not having inflammation all over your body, you're having isolated inflammation in the scalp.
Okay, and I guess that's the same basis for the Nizoral type shampoos for people who have yeast in the scalp. I guess a systemic
antifungal wouldn't work. Exactly. And also that the Nizoral shampoo, I put my male and female patients on routinely, because the Nizoral, not only does it have an antifungal effect, it has an anti-androgen effect. And the anti-androgen effect is that shampoo will, penetrate through the scalp skin, and it causes those receptors inside those hair follicles to be less binding to the circulating scalp androgens.
Interesting.
Yeah, I use it as an anti-androgen shampoo, not as an antifungal shampoo.
And in men, that does not affect their systemic testosterone levels.
It does not, no, because it's not systemically absorbed.
Got it. And you mentioned one other thing that we forgot to talk about during the our conversation about causes, was iron deficiency anemia, which of course is extremely important in women who are premenopausal. Because about 25% of all menstruating women have iron deficiency anemia just from their periods. So that, of course, is something we really don't want to overlook as a diagnosis in general, because it causes fatigue, headache, many other symptoms. And again, it's so easy to treat.
Check. Yeah. And it's important to get a ferritin level, because some, in your panel, sometimes it might just be an iron level. Well, the iron level can show up normal, but if you get a ferritin level, the ferritin level will be low, and low ferritin contributes to hair loss, and to get what we call a TIBC, or a total iron binding capacity, to not just get a blank, just an iron level.
Well, and that's where hormones can also play a factor, because estrogens and other hormones can affect your TIBC.
Yes.
And that's where inflammation can also be a factor, because it's an acute phase reactant. So, this really shows us that whole knee bone is connected to the hip bone thing is really true in terms of all of our systems.
I mean, you're connected from the top of your head to the bottom of your toes,
It's all relevant. And as far as, we didn't really go into stress and hair loss very much, but of course, a classic mother thing is to say to your kids, especially your teenage children, you're making me pull my hair out. But stress really can make you lose your hair. So you want to talk about stress a little bit?
Stress causes an internal body chemistry change where a hormone called cortisol will raise when you're under stress. That cortisol level is recognized by your hair follicles as being too high. They shut down and kick the hairs into that telogen phase. Now, luckily, stress-related hair loss is what we categorize under the telogen effluvium. And the telogen effluvium includes medical causes and medications that, on average, are temporary. Mm-hmm. Remove the insulting thing, 4 to 6 months to 12 months, the injury's been gone and the hair can recover. But yes, what's important to recognize is that if you have the genetics for androgenetic alopecia or inherited hair loss, that constant stress will accelerate or sometimes start the genetic hair loss to begin, because everybody's hair loss begins at a different age. I'll have 18-year-olds come into my office and they, got a class 6 or 7. They're really balding. And then sometimes my patients are 45 before their hair loss starts. Mm-hmm. And so stress and all of those other things that affect your internal body chemistry can be the triggering event to activate those hair follicles to become susceptible to those hormones and accelerate your pattern of hair loss from the hereditary point because of the stress.
And stress can also change your hair color and make you go prematurely gray, as we classically have seen with every president before the current president, has, in the first year of their presidency.
That stress hormone cortisol affects the cortex of the hair shaft, which is where the melanocytes and the pigment producing cells are located, and can cause them to stop producing pigment.
Okay, so now let's talk about treatment. So we're assuming the regular typical patient now has been to their primary care physician and possibly a dermatologist and possibly an endocrinologist, and they've gone that route. At what point do they need some kind of specific or if they want some specific treatment other than a baseball cap?
I'm glad you said baseball cap, because that's an old wives' tale. If you wear a baseball cap, you'll lose your hair. People wear baseball caps to hide that they're losing their hair.
No, I'm saying that's part of the treatment. The baseball cap treatment.
I'll have mothers come in and say, see, I told you not to wear that hat every single day. That's what's causing your hair to fall out. Wearing a hat, not wearing a hat. Washing your hair, not washing your hair. Those are, pretty much things that don't cause hair loss. The majority of causes of hair loss are hereditary. You have an inherited hair follicle cells that are overly sensitive to hormonal changes, and you either have it or you don't.
So I'm talking about treatments aside from wearing a hat.
So the earlier the better. The sooner you can get to those hair follicle cells before they have become injured to the point of no return, the better. And there are a host of proven hair loss solutions that I am glad to be affiliated with Hair Club, because they offer all proven hair loss solutions for people.
So let's start at level 1.
So level 1 would be external, and so because external can be used by both men and women.
And what do you mean by external?
Rogaine, or topical minoxidil. So that's an FDA approved medication that you can buy over the counter. that you apply topically to the scalp that will diffuse into the scalp skin. And it acts as a vasodilator. And so when you dilate the blood vessels, you get more blood, going to the hair follicle cells. And then from a biochemical standpoint, we don't know the exact mechanism of action of minoxidil, but what we do know is that men and women who have hair loss, the potassium channels inside their hair follicle cells are closed. And when we apply that topical minoxidil, it opens those potassium channels. So when you open the potassium channels, the hair cells are working better because the potassium channels are open. So from a biochemical standpoint, the hair follicle cells are stronger. And if the cells are stronger, the root is stronger. And if the root is stronger, the hair shaft that root produces can be thicker and fuller. And a thicker hair covers more scalp than a skinny hair. So you want to get it at the cellular level. So I usually break down medical treatment into two arms. A hormonal arm where you try to address the dihydrotestosterone or the androgens that are affecting the hair follicle cells. And then from a cellular level where you want to make the hair follicle cells as strong as possible.
And is that something you would do in tandem or sequentially?
Together.
Okay.
Yeah. So topical minoxidil is the first place that we start. And there's
and that would be after you had already recommended the Nizoral. That's a separate.
That's together. So when
that would be together.
Yeah, it's all together. You're going to get a host of things that I'm going to tell you that you can use in conjunction. And then we tailor the therapies to what people are willing and not willing to do, so they can pick and choose. I'm going to recommend what you can do, and you can do all things, which is the more you do, because you're hitting it at different mechanisms. So I guess I would call the base level the Nizoral shampoo, because it's the least offensive, and you can wash your hair with it 3 times a week, and everybody's going to wash their hair anyway, so they don't see that as really being anything extra that they have to do. So then we're going to move on to topical minoxidil because it's inexpensive. You can buy it over the counter. There's 2 different formulas. There's a 2% that's quote unquote marketed for women. There's a 5% that's marketed for men. I have all my women patients use the 5%. So there's nothing really in it that makes it, from a hormonal standpoint, specifically for women or specifically for men. The 2% concentration has less of what we call propylene glycol, which is the alcohol vehicle that we use that uses to help it penetrate the skin. Mm-hmm. Women's scalp skins, as far as thickness, tends to be thinner than men's scalp skin. And so a higher concentration of that propylene glycol that can be in the 5% can just be sometimes too irritating to the scalp of women, and it can cause them to be very dry, very itchy, and very burning. And then sometimes, because minoxidil started out as a blood pressure medication, that 5% in a very small percentage of women's can become systemic and cause them to have heart palpitations or feel like their heart's beating fast. And those are definitely things that you need to talk about, when you tell your patients about this, because it is something that you can just get over the counter, but it can have, systemic effects that they need to be aware of. And so I'll tell patients, if you feel flushed or your heart's beating fast, or you feel like it's skipping a beat, or you just don't feel right, you could be one of the, small percentage of women who are getting a systemic absorption of what used to be a blood pressure medication, and they just can't tolerate it.
Well, this is my public service announcement for everybody who's listening, for every over-the-counter medicine, because there is this misperception that if something does not require a prescription, it must be safe. But any medicine that is strong enough to have an effect is certainly strong enough to have a side effect. I don't care whether it's aspirin or Tylenol or even vitamin D.
Yes.
You can have toxic levels of. So, people really need to be cognizant of that with over-the-counter medications, especially if their doctor's not kind of supervising that.
Correct. And so another cellular modality is what we call low-level light therapy.
Okay.
And so that low-level light therapy can come in different devices. We've seen it used as what we call the laser comb, the laser band, or a laser hat. And so we call it a laser kind of for marketing purposes, because the general public thinks lasers are the latest and greatest technology that are going to work the best. It's not really a laser. Lasers are heat destructive. You get laser peels to your face to, get rid of the old skin cells. So it's really a low-level light therapy. And what the low-level light therapy does, you'll remember this from biochemistry.
No, I won't.
From a technical standpoint, it converts ADP, which is resting energy, into ATP, which is active energy. So the more active energy cells that you have in your hair follicle root, the faster they're popping around in there, the stronger and thicker hair shaft that it can form. So we're using it as a cellular stimulator to make the hair shaft that's being produced from that root thicker, stronger, and which results in the appearance of more hair. Neither minoxidil or this low-level light therapy cause new hair follicles to grow. You're born with all the hair follicles you're ever going to get. But what it does is it strengthens the hair follicle cells that makes the hair thicker and fuller, which gives the appearance of growing hair. Now, I take that back a little bit in that sometimes you've got hair follicle roots underneath the surface of the skin that they're alive. The hair cells are just so weak that they can't even produce a viable hair that's strong enough to puncture and exit the epidermis. So the low-level light therapy and the minoxidil, either alone or even better in combination, can strengthen those hair follicle cells if they're still alive, sometimes to the point that they can now regenerate a hair follicle that's strong enough to exit the skin and actually regrow hair. So it's growing hair from hair follicles that are still alive that just haven't been able to stimulate and produce a hair shaft because the cells are too weak.
Now with the low-level light therapy that you're talking about, what kind of regimen would the typical patient be on? How many times a week, and how long is this?
3 times a week for, 15 to 20 minutes.
Okay. And is this with a specific type of device that they
it has to be, there's all types of devices on Amazon and eBay and those sort of things. You really need to get your device from a medical facility because there's a specific wavelength of light that is specific to the hair follicle cells. So it's like in the 600 to 700 nanometer wavelength that is actually specific for skin and hair follicle cells. If you're at the lower end of the spectrum of 200 or 300 nanometers, you're not doing anything other than putting a light bulb, type of a light on your hair, which, if you sit under a light bulb, your hair is not going to, grow or get any better. So a lot of these devices on the internet don't have the right wavelength, nor do they even know if you call and ask them, they don't even know what the wavelength is. And so you actually need a medical grade nanometer light that we know is going to be the right capacitance to be able to stimulate the hair follicle cells.
And just ballpark, what does something like that cost?
Anywhere from like $600 to $900.
Okay, and that's something that would probably be covered by somebody's health savings account.
Health savings account, yes, but it's none of this.
Not by their insurance.
Covered under insurance.
Okay.
Which, that brings me to the topic of hair loss. While it is cosmetic, it really is a medical condition. I mean, you have a diagnosis, you have androgenetic alopecia. There's an ICD-9 code for this, condition. Yet treatments aren't covered under insurance because it's considered cosmetic and elective. However, I'll tell you, the patients that I have that come into my office that are so emotionally distraught from their hair loss, it's a true medical problem. It's a true and becomes sometimes a mental problem. And, patients can even be suicidal from this condition. So it's very important for general practitioners and the dermatologist to recognize this affects women and men to a deeper level than you might ever even imagine.
And that's the other healthcare provider that we didn't discuss referring to.
Mental health, absolutely.
Mental health professional, either a psychologist or a psychiatrist, in part because this can cause mental distress.
It does.
But also in part because what we talked about is that stress can actually cause hair loss. So these people are in a vicious cycle. And we've also talked about that antidepressants can contribute to hair loss. So, they're kind of in this whole vicious cycle kind of situation.
And I really urge my colleagues to take this seriously. Because so many times my patients will come in and say, the doctor that they have seen will say to them, well, just be glad you don't have cancer. It's just your hair. Well, I hate to hear that because for these patients, hair loss is their cancer. It really is what sometimes incapacitates them to get out of bed every day. It's what incapacitates them to, be able to sing in the choir at church anymore because they're afraid that people are looking down on their hair, and it really makes them, hinder their activities of daily living. And it's something that can cause severe mental health issues. I mean, I really had a patient who came in, we did the transplant, and a year later came back in. It was just phenomenal result. And they look at me and they say, I'm embarrassed to say this, but you were my last resort. And I was given this transplant 1 year. And if it didn't work, I was actually going to take my life. So to hear the severity of how what others in the community perceive as just being a cosmetic thing that you should just learn to live with is unacceptable to me. And what I really want to tell patients out there is there are doctors out there who care. We validate how you feel. We know how you feel. We know how it affects you, and it's real. And that there is someone at Hair Club and the Bosley affiliates who understand that, and we're here to hold your hand and walk you through the process, because Hair Club and Bosley offer all proven hair loss solutions. There is a proven solution out there for you. There's not a cure. There's a solution that can be addressed and helped to make it better.
Well, I think we also have a lot of healthcare professionals who are listening to this podcast. And I think we have certainly made the case that not only is this a cosmetic problem, but it's actually a indication that there may be a broader medical problem.
Absolutely.
That needs to be evaluated. And I think you have certainly made the case for all of our listeners, healthcare professionals and people who are not healthcare professionals, that there is a field of medicine that is devoted to the study and broad range of evaluation and treatment for everything that has to do not only with your hair and your hair follicles, but your scalp, which is a significant portion of your body and of your head. So I think that people have probably come away from this discussion with a much greater understanding. Before we wrap up, though, I do want to we got to level 1 of therapies.
Oh, yeah, right.
I don't know how many levels there are, but let's say our patient has done the Rogaine, the light therapy, the minoxidil. So that would be called level 1. Now what's level 2?
Those are things that you can get, quote unquote, over the counter. So now you go to the prescription type of medications. And so for men, there's the FDA approved medication called Alopecia. The generic is called finasteride, and it's a 1 milligram pill. And what it does is it prevents the conversion of testosterone into dihydrotestosterone, which is the hormone that attaches to the hair follicle cells and causes them to miniaturize and fall out over time. So we can prescribe men that medication, and it can arrest the patient's current pattern of hair loss in its current state so that it doesn't progress to get worse. Okay. Unfortunately for women, the DHT is not the primary hormone that's causing their hair loss. And when they did the studies, they studied the 1 milligram pill in postmenopausal women. Women of premenopausal or a childbearing age cannot take this medication, because if they were to become pregnant with a male fetus, that male fetus needs that DHT for genitalia development. So this is, they studied it at 1 milligram in postmenopausal women, and it didn't prove to be statistically significant as far as stabilization or hair regrowth the way it was in men, so it didn't get approved. However, in Europe, which they're a little less strict on their guidelines, they started using it in premenopausal women if they had their tubes tied, their partners had a vasectomy and they were using a second form of birth control, or if they were postmenopausal, and they started using it
if they had a hysterectomy.
Or hysterectomy, absolutely. And so they started using it at a higher dose, 2.5 to 5 milligrams, because this pill, finasteride, is available in a 5 milligram tablet, which is how we found out this medication even worked. And it's called Proscar, and men were using it for an enlarged prostate. So DHT is the same hormone that makes your hair fall out. In men, it's the same hormone that makes their prostate enlarge. So the urology field was, administering this Proscar to men with enlarged prostates, and we started seeing that their hair loss stopped or started growing hair again. And the hair industry said, hey, what is this pill? And so we studied it at different milligram dosages and found out that the 1 milligram dose in men is all they need for it to be significant for their hair.
Now, what are the side effects of this medication?
Yeah, so the side effects are potential, as we know, doesn't affect everybody, and they're relatively a low potential of anywhere from, less than 2%. The main one that men are concerned about is sexual. A lower libido, decreased ability for ejaculation, a decreased ability for erection, or a change in ejaculatory volume. That only happens in less than 2% of people. I tell patients, just to make them feel better, I said, my husband's been on this pill for 15 years.
Are you bragging?
Nor myself, nor my husband would take this pill for 15 years, or I would let him take this pill for 15 years if it was affecting his mojo. So it doesn't.
These are the kind of things we discuss in the ladies' room.
Exactly right. So, and then I tell people, my 75-year-old dad takes this pill, and mama ain't complaining either.
That's awesome. And are men given this pill prophylactically to prevent prostate enlargement?
Not prophylactically, because you need 5 milligrams of the medication in order to shrink the prostate. And so if you're taking the 1 milligram as a hair treatment, you probably are prophylactically potentially,
Has that study been done?
No.
I didn't think so.
Just like, if you have heart disease, you're not taking an aspirin, but you're taking an aspirin to help prevent heart disease. So that 1 milligram is, decreasing your DHT levels that do contribute to prostate enlargement. So there has to be some level of, prevention there, but it hasn't been documented in a.
So is there anything else in the finasteride category level of treatment?
No, but I will use the 5 milligram in women, postmenopausal, or women who have had, a hysterectomy or that sort of thing. Because in Europe, it did show at the 2.5 to 5 milligram dose to stabilize and maybe even get some regrowth. And
now with prescription medicines, despite being used for a cosmetic treatment, I assume most insurance companies are reimbursing for those medicines.
They are not, because they consider it cosmetic. The 1 milligram dose is not covered by men, and the 2.5 to 5 milligram dose is not covered for females. However, I'll tell my patients the 1 milligram dose at Costco is $21 for a 3-month supply. It'll cost you $240 at Walgreens. So
wow.
It's called capitalism in America. So different
marketing.
Yeah. And so, since the patent ran out from Merck in 2013, it's at certain pharmacy locations, it can be very inexpensive. I mean, that comes down to $7 a month.
Okay.
I spend more than that in the Dollar Tree,
I spend more than that on my shampoo. But I like my shampoo. Okay, so we've covered that level. Then what's the next level?
The next level, from my standpoint, would be transplantation.
Okay, so briefly, how does that work?
So we actually surgically remove hair follicles from the back of the head, because we call that the donor area.
Mm-hmm.
If you look at a totally bald man, or even a severely thinning on the top female pattern loss, the hair around the back is still real nice, thick, and lush. It's because those hair follicles, for whatever reason, are genetically different hair follicles than the hairs on the top, and they are not susceptible typically to the hormone miniaturization and degradation process.
Okay, and when you remove these follicles, are you removing them as individual follicles, or are you taking a sheet of skin, or how are you doing that?
So there's two different methods to removal. One is called the follicular unit extraction technique, or excision technique, where I actually use a teeny tiny little hair drill where I will individually drill out each hair follicle from the back of the head one by one.
And that's with local anesthesia, or?
Local anesthesia. There's another technique where we actually surgically remove a strip of the hair, a piece of skin that has all the hair follicles in it, and then we will microscopically dissect that piece of skin into the individual hair follicles.
Wow.
So the end result is you get the individual hair follicle, which is just two different extraction techniques.
Okay, and is this done in a single sitting that you get a sufficient amount?
Correct.
And
yes.
then what's the transplant involve? Is that a separate visit, or is that the same visit?
Yeah, so we will, remove the extraction of the hair follicles, and then I'll take a microscopic little scalpel and make little incision sites to the top of the recipient area where they're, have their hair loss. And then we'll take little, medical tweezers and actually individually insert the hair follicles one by one back into those strategically placed and angled, hair incision sites. And then, vascular supply will allow the reattachment of that hair follicle in the new place. And but it's not immediate. So again, once that hair follicle is moved from the back to the front, it knows I moved it, and it gets scared. And so it jumps into that telogen phase, where that little shaft of hair that's attached to it today will then fall out in a couple of weeks. And then they have to wait 4 to 6 months before it goes, has to go through that telogen phase, and then the new hair follicle will start to grow.
So sort of like planting your bulbs in the fall and getting your tulips in the spring.
Exactly.
Wow.
And
well, that's
if you're not a candidate for transplantation, or, because you might have that scarring alopecia, or because maybe your hair loss is so severe that you don't have enough donor hair for me to be able to remove to cause the kind of aesthetic change that you want, Hair Club offers a solution called X-Trans Plus, which is actually taking the human hair or the synthetic hair and weaving it into a kind of a netting type of a thing that will use a medical grade adhesive that bonds to the scalp, that provides a semi-permanent, they don't like to use the term wig, but hair system.
Hair solution.
That will look fantastic.
Mm-hmm. So it's sort of like getting turf for your lawn.
Exactly. Yeah.
Well, thank you so much. Before I let you go, I want to ask you a question we ask all of our guests. And I should have asked you this at the beginning, but I was just so excited to learn about this whole field of medicine that I didn't know about. What's the most unique, interesting, or memorable experience you ever had in a ladies' room, aside from this interview?
Oh, that's a good question. I should have read up on your podcast so I could.
This is how we find out who's been watching and who hasn't.
Well, just so I can have time to think about this question. I didn't know I would ask this question. I guess, when you're kind of, especially probably at a ball game, I would say, is, you get in there and you're just kind of waiting in line for however long you're waiting, and you're talking to the person sitting in front of you or whatever, and then somebody mentions something and I'll say, oh yeah, I work in hair. Well, what do you do? And I'm a hair loss doctor. So we're, sitting in the, or standing in line in the bathroom, and I'm telling them about, hair restoration, or they're talking about their husband and they're balding, and they ask me for my card because the balding doesn't bother them, but or their husband, but they want their husband to have their hair back, so they'll take my card and end up sending their husband in for a consultation because they met the hair doctor in the bathroom.
I'm guessing you have those kind of conversations at lots of places, not just in the ladies' room, but exactly. At the hair salon,
yeah.
When you're getting your nails done, when you're at your workout class.
Yeah.
And just about everybody. Well, I thank you so much. And I know our listeners really appreciated learning all about this. Where can they go for more information?
Yeah, so you can go to hairclub.com and hear about and learn about all of the solutions that are available through their facilities and where their facilities are located throughout the country. If the surgical part or hair restoration is something that you're interested in, then you can go to bosley.com as well and see of all the locations that are available in your area.
Great. Well, thank you so much. This has really been such a pleasure. All right. Take care.
Thanks, Dr. Donica.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.